Welcome to your weekly wellness dose, The Wellness Factor. I am your host, Dr. Noelle, and today we are discussing MANopause. That's right, you heard me correctly. MANopause. Yes, men, you experience the change too, and we don't talk about it enough, but we're going to talk about it today. MANopause, as I like to call it, or also known as Andropause, the technical term, is the hormonal shift that men experience when going through the change of life, typically at midlife. Now, like menopause in women, MANopause or Andropause can look very different from one individual to the next and begin at different ages. The more common presenting signs of andropause include the following: low energy or fatigue, low mood, depression, loss of muscle mass or difficulty maintaining muscle mass, muscle pain, joint pain, decreased sex drive, decreased morning erections, urinary symptoms, urinary retention or urgency, feeling tired but wired. Now, all of these symptoms are typically due to decreases in testosterone, but there's something else that can occur during andropause, and that is an increase in estrogen. Yes, men, you also produce estrogen, and during andropause, there can be elevations in estrogen, particularly for those who are overweight or obese, as more adipose tissue, i.e. fat, can yield higher estrogen levels. Now, this can present with some of the same symptoms that I mentioned that I described with drops in testosterone, but you may also experience anxiety, nervousness, swelling in the lower extremities, fatigue, burnout feeling, decrease in muscle mass, decrease in libido. So similar to the low T. With that said, there are a battery of tests that should be checked when assessing for andropause. So listen in and ask your doctor for these tests. Number 1, free and total testosterone. You want to know unbound hormone and bound hormone levels. Sex hormone binding globulin typically rises as you get older and has a higher affinity for testosterone, thus less of the total testosterone is free, biologically active. LH and FSH to determine low testosterone being due to a testicular issue, primary hypogonadism, where there can be high levels of LH and FSH, or a brain issue, where there's typically low to normal LH, FSH levels, specifically dealing with the pituitary, which we know as secondary hypogonadism. You want to also check estradiol and estrone. Again, we need to know what hormone shifts are occurring, including abnormal levels of estrogen. I would also suggest checking a full thyroid panel. So TSH, thyroid stimulating hormone, free T4, free T3, and thyroid antibodies, as thyroid disease should be ruled out or assessed as a concurring issue where the presenting symptoms can be similar. Now, when assessing tests, it's important to understand that normal may not be your normal. So what do I mean by this? Well, oftentimes I will check testosterone levels for my male patients, and the numbers are within range, but if you look a little deeper and see that there has been a drop from previous, let's say levels have changed several hundred points, where perhaps you were previously in an 800 range for testosterone, and now your level is below or close to 400, which is technically still normal, but you may be feeling that. And despite it being normal, again, it's not your normal. And that may still warrant hormone supplementation to improve symptoms. So that is something to keep in mind when interpreting the test. Once andropause has been confirmed, the numbers align with the shift, where do we go from here? We can certainly first start with behavioral changes, doing things that can improve levels. Number 1, you won't be surprised by this, exercise. This includes both aerobic and resistance or weight training, as both increase testosterone. Diet considerations: foods high in protein, healthy fats, antioxidants, vitamin D are all helpful to support testosterone levels. Foods such as fatty fish, tuna, salmon, trout, beans, legumes, spinach, all good. Get your rest. Sleep deprivation is associated with decreases in testosterone. Most testosterone is produced during deep sleep phase or restorative phase of sleep, so getting enough sleep is important. Getting less than 8 hours of sleep can reduce testosterone by up to 15%. Avoid toxins. Alcohol. Alcohol can negatively impact testosterone levels and raise estrogen levels. Get your sun. Sunlight is necessary for activating vitamin D, which aids in regulation of testosterone and other hormones. Now, beyond behavioral modifications and natural methods, of course, supplementation is a viable approach. Typically, testosterone supplementation is offered in a few ways. 1, topical form, either a gel or a cream, which you can apply every morning. injectable form, intramuscular injection, which can be given weekly, every 2 weeks, or monthly. Something to note regarding topical form: it may not cause testosterone levels in the blood to rise dramatically, so you really want to follow how you're feeling symptomatically and not just based upon the numbers alone that you see on your labs. Okay? Other options exist to address andropause outside of testosterone supplementation. So if estrogen levels are found to be high, you may consider starting an estrogen blocker, such as anastrozole, which is typically given orally. DHEA, which is a testosterone precursor, can also be given to improve testosterone, as DHEA is eventually converted to testosterone. Supplementation orally or topically may also aid with symptoms of andropause, including improving fatigue, low libido, muscle loss, and boosting mood. It is best first to do a full assessment with your doctor. Okay, know what your numbers are, if there's been a shift in the level of hormones over time, and what your normal looks like. From there, proper steps can be taken behaviorally and medically if hormone supplementation is deemed appropriate. I hope this information was helpful and gave you some clarity as to what andropause or menopause looks like and how we can address it. It is now time for our mantra of the day. Close your eyes. Allow your belly to be soft. As you inhale, the belly rises. As you exhale, the belly falls. So focusing solely on your breath, I am resilient, malleable to the shifts and flow of life, strong enough to persevere through any obstacle or moment of uncertainty. I am resilient, supported beyond measure, protected from all adversity, guided by the divine. I am resilient. Now you can continue with that breath, continue with that thought, or perhaps you've had enough for today. I pray that your day is blessed and protected. Thanks for listening. Namaste.